Hi, welcome to It Takes Guts. I am your host, Stacy. I've been a GI nurse practitioner for the past 6 years, and prior to that, I was a nurse in the endoscopy department for 15 years. I love GI. Today, we are going to be talking about irritable bowel constipation. There are 3 types of irritable bowel diarrhea predominant, constipation predominant, and then mixed. Last week, we talked about diarrhea. This week, we are talking about the constipation side. So typically, IBS is going to be diagnosed by symptoms. We look at something called the Rome 4 criteria. This is where it is associated with these symptoms, abdominal pain or bloating, with a change in bowel habits that occurs at least 1 to 2 times a week and has been occurring for the last 3 months. So when we tie in irritable bowel constipation predominant, that change in bowel habits is going to be constipation. So what is constipation? That can be the size of your bowel movements. Maybe they're really small and you don't get a lot out. The consistency, like the Bristol stool scale consistency, where number 1 on that scale looks like little rabbit pellets. Number 2 looks like very hard, marbly stools. And then number 3 is still a very formed, hard stool. And then again, how frequent are you going? Is it like maybe once a week, once every 2 weeks, or 10 days? Somebody who normally goes once a day, and then now they're saying I'm only going 2 times a week. It's just not my norm. Caveat, you don't have to be an everyday pooper. That does not mean you're constipated if you do not go every day, but you should be able to have nice form, soft stools, feel like you are getting everything out there a decent amount. And I would say, honestly, every 2 to 3 days at the maximum should be your frequency. So constipation is if you're having some of those unusual stools, and then irritable bowel is when you are associating, now, not only am I constipated, but I have a lot of abdominal pain, I have a lot of bloating, I have a lot of discomfort. So again, we diagnose based on the symptoms, but you want to make sure there are no red flag symptoms that we might need to proceed with a colonoscopy or some lab work or x-rays or CAT scans. If you have a strong family history of colon cancer and your symptoms kind of started after the age of 30, we would want to go ahead and consider a colonoscopy. If you have blood on the toilet paper or mixed in your stool, that would be something you'd want to get further worked up. If you're having unintentional weight loss, that is something that might require a little more than us just saying, oh, it's clearly irritable bowel. We might want to do some blood work, colonoscopy, x-rays, things like that. Now, let's say you don't have any of these red flag symptoms. You've had these symptoms on and off since you were a teenager. Then let's start talking about it's probably irritable bowel constipation predominant. So how can we treat this? First thing is not medicine. It's really lifestyle. What are you eating? Fiber is the number 1 thing that we recommend for irritable bowel, be it diarrhea, mixed, or constipation predominant. The fiber helps regulate bowels, brings water into the colon to allow your bowels to move easier. It also provides you with healthy prebiotics, keeps the gut flora healthy, which is really needed. Certain foods can make things worse, gas-producing foods. If you're already kind of leaning towards constipation, if you eat a lot of gas-producing foods, it just gets stuck in your abdomen and you feel even worse, and then you get bloated and you have cramping. So looking at your diet, not that vegetables are a bad thing, but if you find that you are eating a lot of Brussels sprouts, cauliflower, broccoli, onions, garlic, these can be pretty gas producing. You don't need to cut them out completely, but you might want to modify how much you're eating. Moderation is very helpful. Another thing that I had mentioned along with the IBS diarrhea predominant is the low FODMAP diet. This can also be applicable to constipation predominant, where it really, again, looks at some of those gas producing foods. It can make you feel better along with treating your constipation. It helps with some of those symptoms. There are medications. Let's say you're doing the diet, you've really changed stuff up, you're eating more fiber, you're drinking more water, which is very important because water is one of the main things that gets sucked out of the colon. That's its main job. You need to be drinking a lot of water to help things move along. But let's say you've done all of that and you still just can't get where you need. Medications can certainly be helpful, and that's where your GI provider would be utilized for this. There are different medications out there to allow you to get your bowels moving. Not a ton over the counter. There's a few. Miralax is one. You really don't want to do a lot of Senecot or Dulcolaxes or stimulant laxatives. Miralax is a little easier. It's a powder. You can adjust the amount that you're giving yourself to help yourself go a little easier. Prescriptions that are available that have been around for a while: Linzess, Amitiza, Trulance. There are some that are more specific for women with irritable bowel constipation predominant. These are Zelnorm. That's been around for quite a while. Motegrity is another one that sometimes we use, really based on how you respond to them or how significant your constipation is. The other thing is, let's say we've done all of this and you just still feel you've taken your medicines, you're following a diet, you're drinking your water, you're getting your fiber, and you're still like, I just feel like I can't get it all out. I'm sitting on the toilet and I just have to sit there for so long and I just can't get it out. That might be something more than just the constipation from your colon being slow moving. This could be something with your pelvic floor muscles maybe not working as well together as they need to. And if that's the situation, you're like, I sit there and I strain and I can't go and I feel it just there. Talk to your GI provider. That's some stuff that sometimes the pelvic floor muscles don't work as well together as they need to. And you need to have that addressed also. It's really a whole package deal. So if you feel like you are having issues with constipation, you're having a lot of bloating, abdominal pain, or any of those red flag symptoms we talked about, by all means, please contact your primary care provider or your GI provider so we can help you out and get you feeling better. Please like and subscribe to the channel. Leave me some comments, questions that you might want to ask, or some other topics you really want some more information about. And as always, I want you to be educated, informed, and remember, you are not alone. Thank you.